Greetings to all of you. It gives me great pleasure in inviting the chairperson for the fourth technical session of the scientific session, Dr. Kishin Kimura from Japan. Greetings to you, sir. And also, we are very much happy to have with us very eminent speakers for today's sessions, Dr. Sanjay Raghav from Australia, who is an associate professor and a visiting professor at SVIASA and a movement disorder specialist, Monash Health Faculty, Monash University. And also we are happy to invite Dr. Harshal Andhare from Singapore, who will be talking about yoga in enhancing post-COVID recovery, who is an MBBS doctor and a director and a consulting physician at True Care Clinics, Singapore. Welcome to this program. And we are also very much happy to have with us Dr. T.N. Satyaprabha, who will be speaking on efficacy of yoga therapy in epileptic patients, a professor and head of department at neurophysiology of NIMHANS. And we will be now having the first session of the presentation, which will be by Dr. Sanjay Raghav from Australia. And it is very important that as yoga practitioners and yoga therapists that we need to know all the beautiful credentials, efforts, which all the great speakers have got. He's a senior neurologist and movement disorder specialist at Monash Health in Melbourne, Australia. He is a registered yoga teacher and a meditation teacher, taking regular classes. He has an academic position at RMIT and Monash University, where he is conducting research in Parkinson's diseases and other movement disorders. He's also a visiting professor for the Division of Yoga and Life Science with SVIASA Yoga University, India. Dr. Raghav is an integrative neurologist who has embraced yoga, meditation, Ayurveda, and other complementary therapies in his clinical work at Dinamandong Neurology. He conducts regular meditation, mind-body medicine, and Parkinson's residential retreats. He also runs Bhagavan Ramana Maharishi Center for Self-Realization in Melbourne, Australia, on the Advaitic teaching. So it gives us a great pleasure of having you, sir. And over to Dr. Sanjay Raghav.
Thank you, Mr. Vyasa, for a kind introduction. And thanks for SVIASA, Mr. Manoj, and everyone who has invited me to this beautiful conference. And my thanks to Dr. Kazuo Kimura, who is the chairperson for today's program. So I'll try to share my slides. I have slides, and I'm not sure whether you can see those slides. I think I need to. Can you see the slides? I think I need to share it first. Yeah,
not yet, doctor.
Yeah, let me just. Can you see
now,
it now?
Yes, doctor. Now you can go ahead. The slides are very clear.
Okay, beautiful. Okay. So welcome everyone in this session of academic session of, I think last session of this conference. So my topic is enhancing motor and non-motor functions through yoga therapy in Parkinson's disease. So first we will touch base, what is Parkinson's disease? And then we will talk about how yoga can help, and then how yoga can help in different domains of Parkinson's disease. So if we talk about Parkinson's disease, we should not forget the immense research and contribution of Indian surgeons and physicians from the past. So even in 600 BC, Sushruta in his work in Sushruta Samhita has described about Parkinson's disease. He has used the Sanskrit terms like sestanga and sestahani for slowness and akinesia for the first time. Then in 300 BC, Charaka explained Sirakampa as head tremor and other disorders like various tremors, and even explained that it is because of Vata dosha. It was first time in the Western medical literature information about Parkinson's disease came in 175 AD by Galen. Then in 5th century AD, Vagbhat described it. In 8th century AD in India, Madhva described in his treatise in Madhva Vanidhanam. 15th century Ayurvedic classic Baswa Rajyam explains it as Kampavad. And it's only 200 years back in 1817, a UK-based physician, James Parkinson, published an essay on the shaking palsy, which is now known as Parkinson's disease by his name. But if you see, it's more than 2,500 years back that it was known in Indian subcontinent and well described. Now, what happens in Parkinson's disease is there's loss of dopaminergic neurons in the brain stem, in the midbrain. If you see this picture, on the left is the normal brain, and you can see the pigment in the midbrain, which is the cells producing dopamine. While on the right, you can see it is very lightly colored because these pigmentary cells which produce dopamine are less. Now you can see the next middle one. On the right-hand side, you can see less of these pigmentary neurons which produce dopamine. This part of the brain is known as substantia nigra pars compacta. Now, what happens is because of this disorder, degeneration, there is Lewy body accumulation in the brain stem and in different parts of the body as well, which is pathognomic of Parkinson's disease. Now, this is the staging which we are using nowadays, Brack and Brack staging, which very well explains how the disease progresses. Disease starts from the stem and slowly, gradually moves up to the cortex. When it is in the lower part, people have loss of sense of smell as the first symptom. Later, they can have sleep issues, and later they have motor issues like slowness of movement, tremors, and all those things. And as the disease advances, it affects memory, it affects cognition, it affects emotional health. So I'll just show you a patient with Parkinson's disease, how it looks. So these patients have a tremor. A resting tremor means the tremor is while they are not doing anything. Rigidity is the stiffness of the body, and bradykinesia means slowness of the body. So you can see this person is having tremors across both sides of the body. And when he's walking, he's moving less of his arm and he's dragging his leg. You can see some asymmetry. The left side is much more affected than the right side. So there is less movement of the left hand, and there is dragging of the left leg. When I'm asking him to do the finger tapping, you can see the left is much slower as compared to the right side. So it's definitely has affected him more on the left than the right. But the disease is always starts from one side and then affects the other side. So it's unilateral onset, but it involves both sides. And as the disease further advances, there are balance issues. Now you can see on the left, he's having more difficulty in moving his feet. Now the disease not only involves brain, it all involves whole of the body, and it causes various symptoms. It can cause gut issues, constipation, delayed gastric emptying. It can cause fatigue, which is a very common symptom, pain in different parts of the body, sleep disorders, psychiatric symptoms like anxiety, depression, amotivation, apathy, and all those things. And even later on, as the disease advances, people can have psychosis. This is a very good graph showing how the disease advances. So you can see on the left-hand corner, there is constipation, which can be even 20 years before motor symptoms manifest. That means the disease is going on for quite a long time in person's body before you see the motor symptoms. And as the disease advances, they have sleep disorders, which we call as REM behavior disorder. When they enact in their dreams, they have loss of sense of smell. Depression can be before their motor symptoms. Then comes the tremors, shaking, stiffness, slowness. And as the disease advances, they have other symptoms, including cognitive issues, dementia, psychosis, and balance issues and falls. So in Parkinson's disease symptoms, in Ayurveda, it's known as Kampavad, and they have given name to all these symptoms in different treatises, as I explained before. So in Ayurveda, the etiopathogenesis of the disease is because of increase in the apan vayu, which we call accumulation of it, sanchaya, and it gets aggravated. Then it moves into the body. It relocates itself into the part of the body which is weak. When it reaches the brain, Majja Dhatu, it leads to Parkinson's disease, and it involves the brainstem initially. As the disease involves other parts, it can cause muscle rigidity when it reaches the muscles, and as diminished prana enters the manovah srota, causing depression. Now, coming to the modern concept of Parkinson disease, this is what our understanding right now is that the main key driver of Parkinson disease is oxidative stress. There's dysregulation of cellular redox activity, which we all know as reactive oxygen species, which leads to neuronal death. And part of the brain which in Parkinson's is involved is a very high energy demand part of the brain, dopaminergic neurons, because it needs for planning, for execution. And that's why they get involved very easily, because it's a high energy area. And there's a mitochondrial dysfunction because it is the powerhouse of the cell, mitochondria. It gets involved because of this oxidative stress. Now, what is the role of yoga in Parkinson's disease? And look, stress is a very common link between the two things. Now we know that the stress, oxidative stress, and also emotional stress can lead to Parkinson's disease. And cortisol levels are elevated in Parkinson's disease. People who are doing yoga, and we have checked their saliva cortisol levels are low, which means that yoga can lead to decreased stress levels, and hence even in etiopathogenetic, it can help in Parkinson's disease. As we know in yoga, the disease starts from manomaya kosha, goes through the pranamaya kosha, and then comes to the annamaya kosha, or to the body sheath. So the disease starts from the mental sheath and comes to the body sheath, which we know for almost all non-communicable disorders. And the Western medicine or the modern science is also saying the same thing now for most of the disorders. And it holds very much true for Parkinson's disease. Now, this is a very good depiction of what is happening as the human brain is getting more and more into a complex task and less into the simple not thinking. Now, man is thinking too much. So there is a lot of herborization, or you can see more connections in this part of the brain, which is now very sensitive. And if there's any insult, any toxin, environmental, body toxin, virus, it affects and leads to Parkinson's disease. So acute and chronic stress is being implicated in Parkinson's disease. We know that Holocaust survivors from Nazi camps, they came out with bad Parkinson's disease, prisoners of war. Even acute stress can lead to Parkinson's disease, as we have seen in case report and series. Stress can increase Parkinson's symptoms, as we all know. High levels of cortisol are seen in Parkinson's disease, and it's also being proven in animal models. So what happens when there's a chronic stress? Chronic stress affects brain in all domains. It causes decreased neurogenesis of the brain. It causes oxidative stress, as we have already spoken about. It causes neurodegeneration, neuroinflammation, which is seen in Parkinson's disease, and it leads to increase in the cortisol, which is the stress hormone. How yoga can help in Parkinson's disease? Actually, yoga can decrease oxidative stress and inflammation. There was a very good study done, which was published in 2015 from India, I think from Andhra Pradesh, in which they looked on telomere length. Now, telomeres are the caps at the end of chromosomes. So what happens is, if the telomere length is less, it shows there is aging, there is decay, and the person might die young or early. And it is being affected by various reasons, including our metabolic health, cardiovascular disease, hypertension, and especially oxidative stress and inflammation leads to shortening of telomere length. In this study, they found that people who were practicing yoga regularly, the leukocyte telomere length was well preserved in these people, which again points that yoga decreases the oxidative stress and inflammation. There are various drugs for Parkinson's disease. I'm not going to go in detail. When these drugs fail, then we go for various other non-oral treatments, like going for an apomorphine pump, which goes into the skin, or there is another pump, which is a levodopa carbidopa gel, which goes into the stomach, or we sometimes subject patients for deep brain stimulation surgeries of the brain. So how can we avoid all these invasive surgeries? By integrative approach in Parkinson's disease. So what we can do is we can start with the mainstream treatment, but we can also start things like yoga. As we know, the yoga incorporates pranayama, and it's found that pranayama breathing techniques have profound effect on vata, and Parkinson's disease is a vata dosha. Meditation decreases stress, and decreased stress can improve Parkinson's disease. Apart from that, we can borrow treatments from Ayurveda, internal and external therapies like Panchakarma, improving lifestyle, and other things like physiotherapy and hydrotherapy, and all those things can be very useful. So we run regular Parkinson's wellness retreats in Melbourne, which are quite good for Parkinson's disease. It's a 5-day program. Now, how yoga can help in Parkinson's disease? We all know that yoga is a science of art of healthy living. Traditionally, it is for self-realization, but now it is being promoted and it's being found to help in disease prevention and disease cure and also disease control. It is being found that yoga is very promising for neurodegenerative brain disorders. And there was a study in which it found that it improves the functional connectivity within the basal ganglia corticothalamic feedback loop as compared to the one who were not doing it. So it really works well for Parkinson's disease. Now, benefits of yoga therapy has found in both in motor symptoms of Parkinson's disease and non-motor symptoms of Parkinson's disease. There was, all this literature, all this scientific evidence has come only in last less than 15 years. And if you see, all these papers have started coming only after 2010, not even 15 years. So this study, which I found was a 12-week program of yoga in which they found all the motor scores improved. The same group also found that there was improved flexibility, strength, gait, and quality of life of patients who were doing yoga. Then there were more studies came in which they found that the yoga improved motor functions, including postural stability, gait, freezing of gait, which is an advanced symptom of Parkinson's disease, also improved. Improving motor dysfunction, but also improving anxiety and depression. So spiritual well-being of these patients. So it's not just motor symptoms which improve with yoga, but also non-motor symptoms and cognition. So there were further more studies which were also proving that yoga can help in different ways, published from different centers. There was a pilot study done in California State University. It was an 8-week yoga program, which also found that there was improvement in the balance. And there was a meta-analysis done, which came from Japan, in which they found that the exercise improves balance and mobility in people more than 60 years and over. So in a nutshell, benefits of yoga therapy in Parkinson's disease improves almost all motor symptoms, visible reduction in the tremors and shakes, improvement in the gait, control of body movements, better mobility, range, improved dexterity, decreased stiffness, and improved balance. Yoga, there is a very good study published a couple of years back in JAMA Neurology, coming from Hong Kong, in which they have found that yoga not just improves motor dysfunction, but it also improves non-motor. It improves mental health, it improves cognition, it decreases anxiety and depression, and also spiritual well-being of patients. Improvements were, another study found that there is improvement in all the measures found for balance, activity, and also quality of life, as done by the PDQ-8 questionnaire, which is the very subjective patient-oriented measure. Now, this study is unique because in this study, what they did was they did structural brain morphometric analysis, in which they found that actually there were changes in the brain of patients who were doing 8 weeks of mindfulness yoga program. They had 14 patients and they were meeting up for 2.5 hours on 8 consecutive weeks. And in this study, they found that the patients who were doing yoga, their gray matter density changed. The part of the brain which gets involved in Parkinson's disease increased in gray matter density, while patients who were not doing yoga, compensatory cerebellum gray matter density increased to cover that up. So this is a very unique study in which they found that the yoga actually makes changes in the brain structure. This is a very interesting case report in which they found a patient who had Parkinson's disease for many years, more than 10 years. And this was proven by SPECT-DAT scans, by his classical symptoms, and also improvement with levodopa therapy. But this patient had a complete remission of Parkinson's disease. And this was because of his long history of meditation practice on a regular basis. Now, it is well recognized that Parkinson's symptoms and signs can be improved in settings where external or mental stimuli can be given, like we give visual cues, auditory cues, which can improve their walking. Like they can say 1, 2, left, right, or you can put stripes on the ground and then they can watch it and then they can improve. Same thing, we have found that rhythmicity helps them. Music, dance, and emotions and positive emotions can help. So it is not a study done on Bhakti Yoga, but with all this information, I'm proposing that people who are interested in Bhakti Yoga and devotional bhajans and dance and music, that can help a lot in Parkinson's disease. Yoga improves sleep. Now there are 2 studies which I came across, both from SVYASA, one in 2005 by Manjunath and Shelley Tellis. The other one was done recently by Sri Ganesh and Subramaniam, which was published this year. Both have found that yoga improves sleep in various forms. Time taken to fall asleep is reduced, number of hours sleep is increased, feeling of being rested in the morning is better, and number of awakenings in the night has decreased. Now Parkinson's disease can affect gut in different ways, starting from your mouth up to your colon, causing constipation, delayed gastric emptying, nausea, bloating, and all these symptoms. So yoga can improve gut health. And this was a study done from SVYASA, in which they found that yoga can help improve constipation. In this study, they were doing yoga 3 times a week for 3 months. And then there are other studies which have also found that the yoga therapy can help with even chronic constipation with irritable bowel syndrome. I found more studies on irritable bowel syndrome that yoga can help. Yoga improves depression, and there are various studies in which they found that yoga helps in anxiety and depression in Parkinson's disease. But then there are a lot of studies which have shown that yoga helps in patients with anxiety and depression. Now, cognitive impairment is also quite common in Parkinson's disease. 85% of Parkinson's disease patients can have cognitive impairment 15 years into the disease. And this can increase carer stress. This is the main reason for nursing home placements in modern world, and also decreasing the quality of life of patients. Parkinson's disease dementia can be prevented by meditation. Meditation has great potential for preventing it. And I believe any yoga program should have a meditation. And I'm pretty sure all yoga programs have meditation as its component. So yoga improves cognition, yoga improves executive function, working memory, attention, processing speed, improves mental health among elderly patients with dementia, and also mild cognitive impairment. So benefits of yoga therapy in non-motor symptoms are better mental health, reduced depression, decreased anxiety, decreased fatigue. There's improvement in sleep, as we have seen in various studies, improves attention, mindfulness, improvement in cognition, decreased chances of dementia in Parkinson's patients, and improvement in bowel movements and constipation. So in a nutshell, Parkinson's disease and yoga goes together. The reason is because yoga has multi-dimensional effect on a person. It changes our body, our mind. It connects us to our own beingness, our spiritual entity, our consciousness within. And which I was listening to Rajendraji's lecture, and again, it connects you to the divine source. So you get to the powerhouse, you get to connect it to the ultimate powerhouse. And here the whole issue is with the power. It is a mitochondrial dysfunction, which is the powerhouse of the cell. But when you connect to your own real powerhouse, things start improving. So recent research has also pointed out that there's a chronic oxidative stress which leads to Parkinson's disease, and yoga has a big role to play in that. And yoga therapy has been found to be effective not in just motor symptoms, but also non-motor symptoms, including cognitive symptoms. Yoga does not just help with the increasing in the dopamine, but also helps with serotonin, noradrenergic, BDNF. These different neurotransmitters are implicated in Parkinson's disease. Enhanced neuroplasticity, as we have seen, there are structural changes in the brain MRI, people who are doing yoga in Parkinson's disease. As an intervention, yoga may be suited to any patient of Parkinson's disease. Patients who can't sit on the mat, they can do chair yoga. They can sit on the chair and they can do exercises, and they can do to their own ability. So it can be tailor-made, it can be individualized, and that is the benefit of yoga. So it helps with flexibility, strength, postural alignment, and relaxation. So I would invite, if anyone who lives in Australia, and if things are open, we are running a retreat in November for 5 days in beautiful Yarra Valley, where you can be with kangaroos doing yoga, meditation, and it is really good if someone wants to join. And I would like, again, thank you to everyone who is listening, and thanks to the organizers to giving me this opportunity to share my own experience with yoga and Parkinson's disease. Thank you, everyone.
Thank you very much, Dr. Sanjay. There are several questions to you. So first one is, how can one confirm, I can read, a component, how can you confirm that someone is stressed before treating the person? So you, this Parkinson's disease related to the stress, how can you diagnose the stress of that patient, and how you decide to treat the patient through those? Yes.
Look, I have to say here that when we are treating someone for Parkinson's disease and we are implicating yoga, it's not that only if they have stress, then we will do yoga. But definitely, when we talk about stress, stress can be quite obvious. It could be because of the chronic stress. I have not come across even one single person who is not stressed. So stress implicates in different ways in different people. If you want to know if a person is suffering from stress or not, you can take a good detailed history of that patient, and you can find out what is going on in last few years or 10 years in their life. And that can help. But yes, you can check their cortisol level. Serum cortisol level can help you to know if there is increased stress level.
Thank you, Dr. Sanjay Raghav. I think we will be taking more questions at the end of all the presentations, and I think you can elaborate with these questions a little bit more. So thank you very much, Dr. Sanjay Raghav, for this wonderful presentation of connecting. Thank you very much.